Glutathione, that's a super powerful, the most powerful antioxidant in the body. It's involved with hormone detox. It's involved with immune system regulation. It's involved with detoxification of metals and other metal toxins, you name it. Sulfation utilizes cysteine, which is very sulfur rich. And so sulfur rich foods contain lots of cysteine. But then NAC is a super powerful or super common supplement that people will take to support that NAC. It was popular in the COVID days. But then the last pathway is something called glucuronidation. And that is supported through something called glucuronic acid. And that is found in high amounts of things like artichoke extract, stuff like that. And so in our offices, we'll actually recommend that patients take artichoke extract to help detoxify things like estrogens, cortisol, testosterone, you name it. All that stuff. So that being said, that is, I would argue, always a background issue at the very least, if not the forefront issue, whenever there is a vagus nerve issue. Even if you find that infection is affecting the vagus nerve primarily, usually there is some sort of liver detoxification issue of stress involved, or there's a liver detoxification issue of toxins that secondarily will contribute to hormone detoxification issues. So it's kind of a big picture thing. You know, there's so many different things that feed into it, and it just, all in all, they all cause stress. So that's pretty much all I would add to that, other than just there's so many more different kinds of toxins that our body has to deal with. You know, you mentioned like aldehyde toxicities, ammonia is on that list, bleach or hypochlorite's on that list, hydrogen peroxide. You know, all of these chemicals that our body will produce with the goal of balancing the immune system and killing off microbes. Those are all things that we have to deal with in order for the vagus nerve to function properly. And so it also, with let's turn that faucet of those issues or toxins off by dealing with infections, by dealing with whatever is driving them in the first place. So anyway, all in all, infections or other immune system drivers, whether that's, like you said, viruses, gut infections are high on that list, sinus, bladder, you know, any hollow organ that infections can move into, as well as just systemic infections and viruses. Hormone issues, so detoxification of hormones, but then toxins. So dealing with all those. Those are the main chemical drivers of stress.